Good evening. Welcome to the National News Broadcast. I'm Kasuni Balachandra.
A very good evening indeed. I'm Charitha Prarachi, and now let's move on to the headlines for tonight's news.
Another 657 COVID-19 recoveries reported today. The total recoveries has increased up to 9,500. The permission of the Director General of Health Services is mandatory to convene staff from movement-restricted areas for essential services. Cabinet approval has not been granted over the burial of the deceased COVID-19 patients of the Muslim community, Minister Kehalia says. The grace period for the installment payments of the Saubhagya Resurgence Credit Facility extended by 3 months. Bus fares revised temporarily from midnight today.
On to those and other stories in detail now, and starting off with local stories. The National Operational Centre for the Prevention of COVID-19 Outbreaks says the number of COVID-19 related recoveries in the country has increased up to 9,537. A total of 657 COVID-19 patients were discharged from hospitals following their complete recovery today. Another 113 COVID-19 patients directed to Polonnaruwa, Velikanda, Ponani, Gallevela and COVID-19 intermediate treatment centres left the centre following complete recovery. The patients were identified as residents of Colombo, Gampaha, Kandy and Kalathura districts. Director General of Kegol General Hospital Dr. Mihiri Priyangani says that another batch of 20 patients at the COVID-19 treatment centre in Pinnavala have fully recovered and left the centre. So far, 138 persons are continuously receiving treatments. 3,884 COVID-19 patients have fully recovered in the past 7 days in the country. The highest number of recoveries was reported on the 5th of this month, which amounted to 765. A total of 595 COVID-19 recoveries were reported in the country yesterday, and a further batch of 567 recoveries were recorded today. The other active COVID-19 patients are currently being treated in 37 hospitals and 15 treatment centres. The 36th COVID-19 related death was reported in the country yesterday. The final rites of the deceased female was conducted at the Kolonnawa Public Cemetery, adherent to quarantine regulations today. The deceased 84-year-old female has been identified as a resident in Kalana. The patient died yesterday following her transfer from a private hospital to IDH Hospital, Angoda. Reports have indicated that the deceased has been suffering from a long-term illness prior to her death. Meanwhile, another 4 COVID-19 related deaths were reported today. One of the deceased was a 51-year-old male residing at elderly home in Rajagiriya. The deceased has been admitted to the Colombo National Hospital on November 7th and had died due to the COVID-related pneumonia condition. Another deceased has been identified as a 45-year-old male residing in Colombo 10. The patient was admitted to the Colombo National Hospital on October 23rd and had died due to the infection in the respiratory tract. Meanwhile, a 63-year-old resident in Udugampala, Gampaha and succumbed to COVID-19 related complications at the Gampaha District Hospital. She was admitted to the hospital on November 9th. The closest cause for the death has been due to the COVID-related pneumonia condition. The other deceased, as known as male between the ages of 55 and 60. The body of the deceased was directed to the post-mortem November 8th. According to the deceased, had been declared as a COVID-19 patient. A total of 7,986 PCR tests was conducted in the country yesterday. Accordingly, a total of 610,836 PCR tests has been conducted in the country thus far. Director of the Lady Ridgeway Children's Hospital, Dr. G. Vijay Surya said that the treatment services continue to be conducted in the hospital adhering to the health guidelines. Through several COVID-19 patients were reported in the hospital. Therefore, the director of the hospital informed the patients can continue with their treatments without inflicting any fear. And meanwhile, 41st COVID-19 related death was reported in the country this evening. The deceased has been identified as a 48-year-old resident in Ragam. The person had died at the residence and the deceased was identified as a COVID-19 patient following the post-mortem. The Director General of Health Services mentioned that deceased had been suffering from a prolonged cancer condition. And now let's move on to the world update of the COVID-19 pandemic. The COVID-19 death toll in Europe is set to pass 300,000 and authorities fear that despite hopes for a new vaccine, fatalities and infections will continue to rise as the region heads into winter. Meanwhile, the global number of confirmed COVID-19 cases has reached more than 50.9 billion thus far, with the death toll reaching over 1.26 million. The number of cases in the Americas was over 21.73 million, while Europe and Southeast Asia registered more than 13.36 million and 9.69 billion cases respectively. The world's population stands at around 7.7 billion, yet the global number of COVID-19 cases crossed the 50 million mark, indicating 1 in every 154 people has contracted the virus. It took 32 days for global COVID-19 infections to soar the 40 million from 30 million, while it only took a mere 20 days for cases to jump to 50 million, indicating the pandemic is accelerating spreads worldwide. With only 10% of the world's population, Europe accounts for almost a quarter of both 50.9 billion cases and 1.26 million deaths globally, and even its well-equipped hospitals are feeling the strain. After achieving a measure of control over the pandemic with broad lockdowns earlier this year, case numbers have surged since the summer, and governments have ordered a second series of restrictions to limit social contacts. Europe has reported 280,000 cases a day, up 10% from the week earlier, representing over half of all new infections reported globally. Britain has the highest death toll in Europe at around 49,000, and health experts have warned that a current average of more than 20,000 cases daily, the country will exceed its worst case scenario of 80,000 deaths. France, Spain, Italy and Russia have also reported hundreds of deaths a day, and together the UK accounts for almost 3/4 of the total fatalities. The United States topped all countries in the world in both confirmed coronavirus cases and deaths. The nationwide caseload surpassed 10.1 million thus far, and the death toll exceeded 238,000 in the country yesterday. In less than 10 months, the US has seen up 10 billion COVID-19 cases, indicating 1 in every 33 US residents was infected with the virus. The United States has around 4% of the world's population, yet accounts for 20% of the global coronavirus infections. India, which is the second worst hit country in the world in terms of the number of infections, added 45,903 new cases in 24 hours, taking its tally to 8.59 billion, with the total death toll reaching 127,000.
US regulators yesterday authorized emergency use of the first experimental antibody drug for COVID-19 in patients who are not hospitalized but are at risk of serious illness due to their age or other conditions.
The U.S. Food and Drug Administration on Monday granted the emergency use of the first experimental antibody treatment for COVID-19. Eli Lilly's bamlanivimab is a monoclonal antibody, or a synthetic copy of an antibody used by the immune system to fight infection. The U.S. government has purchased 300,000 doses of the drug, which the company said it will begin shipping immediately. There will be no out-of-pocket costs for patients, according to U.S. officials, although healthcare facilities may charge an administration fee. Trial data showed that a one-time infusion of Eli Lilly's treatment reduced the need for hospitalization or emergency room visits in high-risk COVID-19 patients. U.S. regulators have authorized Eli Lilly's treatment for patients who have been recently diagnosed with mild to moderate COVID-19 over the age of 65, and for patients 12 and older who have an underlying health condition. The treatment will not be used on patients already hospitalized or who require oxygen therapy, as a U.S. government-sponsored study found it could worsen the clinical outcome in these cases. In an emailed statement, the White House hailed the FDA's decision as a major milestone. U.S. President Donald Trump received a similar treatment created by Regeneron after he was diagnosed with the coronavirus in early October. Regeneron is currently seeking emergency approval for a dual antibody treatment against COVID-19. Meanwhile, Eli Lilly anticipates manufacturing up to 1 million doses of bamlanivimab by the end of 2020 for use around the world through early next year.
And meanwhile, Brazil's health regulator has suspended a clinical trial for China's coronavirus vaccine, citing a severe adverse event involving a volunteer recipient. The coronavirus vaccine, developed by the Chinese Sinovac Biotech, one of the several in final stage testing globally. Brazil has been one of the countries worst affected by coronavirus, recording more than 5.6 million confirmed cases, the third highest tally in the world, and nearly 163,000 deaths so far.
Brazil has suspended a clinical trial of China's coronavirus vaccine, citing a severe adverse incident. The country's health regulator, Anvisa, said on Monday the event took place on October the 29th, but did not give any more details. While Sao Paulo's Medical Research Center, Butantan, which is leading the trial, was surprised by the move. Its head said the decision was related to a death, but added that it was not connected to the vaccine. Sinovac did not immediately respond to requests for comment. President Jair Bolsonaro has previously criticized China's vaccine as lacking credibility. Comments which put him in direct opposition to the governor of Sao Paulo, João Doria, who has spearheaded the project. Doria, who's widely expected to run against Bolsonaro at the next presidential election in 2022, plans to import and produce the vaccine, which could be rolled out as early as January. He's already started building a facility which will have the capacity to produce 100 million vaccines a year, and an order for 120,000 doses of Sinovac is due to arrive in a little over a week. Trials of the vaccine are being carried out in Turkey and Indonesia. Neither country has reported problems, and thousands of people in China have already started receiving doses under an emergency use program. Brazil has been one of the countries worst affected by the coronavirus, recording more than 5.6 million cases and more than 160,000 deaths.
Something that changes your life story. Litro Gas.
The chief epidemiologist, Dr. Sudat Samaravira, says that health authorities have paid a keen attention on the global process of introducing a vaccine for COVID-19. He said there are advantages and disadvantages in using such vaccines. The chief epidemiologist made these remarks in a media briefing held in Colombo today.
As well as now the talk about a vaccine is there for the COVID-19, and yesterday also there was a meeting chaired by Honorable Minister, and also in the presence of Honorable State Minister, the country representative to World Health Organization in Sri Lanka, and also our Secretary and the Director General of Health Services, and a group of experts on this. And the discussion, the current status of the vaccine is that there are hundreds of vaccine candidates has been doing some sort of research on vaccines, and now several vaccines are in the pipeline that are still that they are under clinical trial level, under research, but we hope that a vaccine or several vaccines will be available at least by mid of next year. Until then, that we have to live with COVID. Even the vaccine comes, there are advantages as well as disadvantages. This vaccine will cost, it may range from 1,500 to 4,500 or higher. And also that some vaccines will have to give only one dose, one shot of the vaccine, but some vaccines will need 2 shots. And also the immunity that is gaining will be remaining only 1 year or 1.5 years time, like that. It will not give us a lifelong immunity. So because of that, most likely that this type of vaccine we will have to repeat annually. So there are some advantages and disadvantages, but until that vaccine comes, that we can't relax ourselves, that we have to live with this COVID. At least for next couple of years we will have to live with this COVID, and we will be experiencing that reporting of cases from here and there during this period. So because of that, what we have to do is that adhere to our simple guidelines, that is not to come to the society, avoid the society as much as possible, stay at home. Especially those who are elderly and who are having chronic diseases should not come to the society unnecessarily. And if you are coming, that you have to maintain the 1 meter distance, should wear a mask properly, closing your nose and the mouth, and also should be careful about the hand hygiene, should have wash your hands frequently with soap and water or using alcohol based hand sanitizer, and also should control your cough and sneezing with your elbow or a tissue, and also should avoid touching your face frequently. If these things are doing well, I hope and I am sure that even without a vaccine, we will be able to control this disease very effectively. So I think that the people are having a very big role here to get empowered themselves and do these practices to avoid getting the COVID themselves and to take it home.
Chairman of the State Pharmaceutical Corporation, Dr. Prasanna Gunasena, says that the government has yet to purchase any testing kit relevant to antigen testing. The relevant tender procedure is currently in process for the purchasing purposes. At present, Sri Lanka has only received 100,000 antigen test kits donated by the World Health Organization.
I think currently the whole world is facing a situation where the contact tracing and surveillance of this COVID-19 has become a major challenge to everybody in the world. So as a result, the WHO has recommended the rapid antigen testing as a method of contact tracing, surveillance of the illness in when there is a pandemic going on and rapid spread, and also when there is a suspected close communities to identify the patients as quickly as possible. Because everywhere in the country, the lead time from checking the PCR to the result is more, and it gives a little bit of room for the people to walk around, go around and spread the disease. So because of this reason, WHO has recommended 2 types of test kits to be used as the rapid antigen test. When this was actually recommended around mid-August, at that point, Sri Lanka did not have a pandemic because we could control the illness by that time. But in September, when this actually started to spread fast, the virologists and the epidemiologists and the scientists who are involved in this has also recommended, in addition to the PCR testing, to get down the rapid antigen testing to be used in Sri Lanka. And based on those recommendations, Health Ministry has requested WHO as well as the SPC also requested WHO to get at least 100,000 to 200,000 of these tests. But they have communicated to us initially that WHO is committed to supply these items to many poor countries, and it will take at least 3 weeks to 4 weeks for them to provide the rapid antigen testing to Sri Lanka. And Secretary Health has negotiated with the India office of WHO and our WHO office in Sri Lanka, and they agreed to give 100,000 samples, test kits, and I think they were delivered yesterday to the Ministry of Health. But 100,000 is, if we do 10,000 tests per day, it will be over in 10 days. So because of that, Medical Supplies Division has made a request to State Pharmaceutical Corporation to float a tender to buy the WHO recommended or any validated test kits to do the rapid antigen testing. And we floated the tender on 29th of October, and it was open on 2nd November. And we got 29 companies actually bid for the tenders, and currently we have made a schedule and given it to a technical evaluation committee headed by laboratory heads, the clinical heads and the scientists, and they are validating the test at the moment. And once they do the validation, and when they make their recommendations, we will meet in a tender board and then decide what test kit we should be purchasing. Until such time, the government has not committed to buy any bought by any company in Sri Lanka. We are going in competitive bidding, and once the competitive bidding is completed, we will be purchasing. And currently for the PCR testing, we spend about 3,200 rupees, and WHO price for the rapid antigen test is $5. So it should come around 1,000 rupees, and we expect due to the competitive bidding, we would be able to reduce the price further. And at the same time, lately we have found that there's another technique called loop mediated the isothermal amplification. It's called LAMP technique, and a Medical Research Institute and SlimTech is working on that, and they have validated about 300 samples for the time being, and we are trying to incorporate that technique into our PCR system. And then if we could do that, we can do faster PCR testing and get the results quickly. The whole idea of doing all these things is to identify the patients as quickly as possible, and we give the treatment to the necessary people, and also protect the community and stop the rapid spreading of this illness, so that we can bring back the normalcy of the country as soon as possible.
And the trading activities of temporarily closed Beagood Economic Centre due to the COVID-19 outbreak was commenced today. The trading activities began after disinfecting the entire economic centre. Following the resumption of the trading activities at the Beagood Economic Centre, many lorries with vegetables and fruits arrived at the premises from various parts of the country, including Puttalam, Dambulla, Anuradhapura and Abilapitiya. The body temperatures were measured upon the arrival of the traders and their assistants. Meanwhile, trading and distribution activities of the economic centre in Tamuttegama, Kappatipola, Ratmalana and Narahempita were carried out successfully today. The trading and distribution activities of the economic centre had been carried out in accordance to health regulations as per the management of the economic centres. They have also mentioned that an active involvement of the traders and other involved parties was seen at the premises today. And meanwhile, Minister Kehelia Ramukwella says that the Cabinet of Ministers has not granted approval of the burial of the deceased COVID-19 patients belonging to the Muslim community in the country. The minister said that a decision has reached at the meeting to direct the issue to a committee or committees which would take decisions on technology and healthcare basis. Minister Kehelia Ramukwella has said that a baseless opinion has surfaced claiming that a Cabinet of Ministers has granted approval over the burial of the deceased COVID-19 patients belonging to the Muslim community. He said that such decisions has not been reached at the Cabinet of Ministers.
Ministry of Finance says that a decision has been reached to extend the 6-month grace period to pay the installments for the loans obtained under the Saubhagya Resurgence Credit Facility by another 3 months. The loan scheme was initiated at a low interest rate of 4%. The relevant grace period can be facilitated for the loan borrowers through a written request to the loan extended banks. The Saubhagya Resurgence Credit Facility was implemented to uplift the small and medium-scale businesses and individuals affected by the COVID-19 outbreak. The government has reached a decision to extend the 6-month grace period to pay the installments for the loans obtained under the Saubhagya Resurgence Credit Facility up to 9 months. The decision was reached considering the challenges faced by most credit borrowers and the struggle to uplift their respective businesses due to the second wave of COVID-19. Under the Saubhagya Resurgence Credit Facility, more than 61,907 businesses have obtained loans amounting up to 177.9 billion rupees at present. The Saubhagya Resurgence Credit Facility was initiated with the aim to revive the businesses adversely affected by the COVID-19 outbreak in order to contain the hampering of living conditions of the people and the economic growth of the country as a whole. Under the credit facility, loans were granted for the businesses with below $1 billion worth turnover per annum. However, loans were also granted for tourism, exports and related logistical supply sector businesses with about 1 billion rupees turnover.
And now the Democratic candidate Biden is headed to the White House after winning last Tuesday's election. Here's a look at some of the policies of the president-elect and his team are hoping on proceed with one on day on really his 4-year term in office.
The Paris Climate Accord, a civil rights bill, tax reform. Joe Biden has a long White House wish list, which can now turn into a to-do list. These are some of the actions the president-elect wants to look into from day one, January 20th. Biden says his number one focus is getting the coronavirus under control. He'll push for masks to be worn nationwide, stay with the World Health Organization, and move towards making testing, treatment, and vaccines free for all Americans. For economic recovery, he plans to force government agencies to buy American-made goods and services. He's also promised to undo many of Trump's tax cuts for corporations and the wealthy, though the changes do require congressional approval. Biden has also vowed to increase tax enforcement and to bolster workers' unionization rights.
This is the time to heal in America.
Within his first 100 days, Biden's pledged to work on getting the Equality Act passed as well, a bill adding vast new protections based on sexual and gender identity. And while he pursues new gun control legislation, Biden's promised to ban the importation of assault weapons. When it comes to immigration, Biden's planning a new bill as well, which includes a pathway to citizenship for around 11 million immigrants, and also increases protections for the so-called Dreamers, the immigrants brought to the U.S. illegally as children. He also plans to rescind Trump's multiple travel bans, which relate mainly to majority Muslim or African nations. Biden says he wants to rebuild the United States' credibility abroad after 4 years of Trump's America First approach. Notably, he plans to re-enter the Iran nuclear deal and the Paris Climate Accord.
The World Health Organization chief has welcomed efforts to strengthen the Geneva-based body through reform and said that it was looking forward to working closely with the administration of U.S. President-elect Joe Biden.
The Director General of the World Health Organization, Tedros Adhanom Ghebreyesus, congratulated Joe Biden on his US election win on Monday and said he was looking forward to working closely with the new administration.
We congratulate President-elect Joe Biden and Vice President-elect Kamala Harris, and we look forward to working with his administration very closely. We need to reimagine leadership built on mutual trust and mutual accountability, to end the pandemic and address the fundamental inequalities that lie at the root of so many of the world's problems.
Donald Trump has accused the WHO of being China-centric in its handling of the pandemic, a charge Tedros has repeatedly denied. And Trump has frozen US funding to the organization. However, Biden has said he'd reverse the decision on his first day in office. Tedros says funding remains an issue for the WHO.
Predictable and sustainable funding remains one of the fundamental challenges for the future success of this organization. For WHO to do its job, we must address the shocking and expanding imbalance between assessed contributions and voluntary, largely earmarked funds. In the past decade, the world's expectations of WHO have grown dramatically, but our budget has barely changed.
Last week, an oversight panel called for reforms at the WHO. They include predictable and flexible funding and setting up a multi-tiered system to warn countries earlier about disease outbreaks before they escalate.
27 police divisions and 5 Grama divisions in the country have been isolated at present due to the COVID-19 outbreak. Even though the quarantine curfew imposed in Colombo district has been completely lifted, 13 police divisions in the district are continued to be isolated. The Grama divisions of Angulana North and Angulana South were isolated yesterday until further notice. Also, the police have informed the residents of Metsanda Sevana, Mihijaya Sevana, Modararanbina Sevana, Sirisanda Uyana and Maligavatta NHS housing complexes to refrain from travelling outside and remain in their residences. In the meantime, 8 police divisions in Gampaha district, including Kandana and Mahabage police divisions, have been isolated. Meanwhile, 2 police divisions in Kegor district will be further isolated. Although the Mavanala police division is currently under isolation, the Mavanala Pradeshiya Sabha was convened this morning. Officer in charge of Mavanala police arrived at the Pradeshiya Sabha premises and directed a court order to the chairman and the secretary to postpone the session of the Pradeshiya Sabha for a period of 7 days. 2 police divisions and 1 Grama Niladhari division in Kalathura district will continue to be isolated. 2 Grama Niladhari divisions in Kurunagala urban limits have been isolated, while 3 Grama Niladhari divisions in Kuliapitiya police division have also been isolated. Issuing a statement, the Ministry of Health has indicated that the permission to bring the relevant staff from the areas with restrictions imposed on movement for services should be obtained from the Director General of Health Services. Accordingly, the staff can travel from isolated areas under the permission granted by the Director General of Health Services and stipulated conditions in the permission. Meanwhile, the police headquarters have mentioned that the curfew passes issued to travel across the quarantine curfew imposed areas would not be valid to travel across isolated areas or to travel from those areas. A letter should be directed to the Director General of Health Services by the relevant institutions in order to obtain permission to travel across the isolated areas based on special reasoning. The application consists of the names and addresses of the institution, the date or the period on which the staff will be convened for duties, details of the staff and the medium of transport. Special reasoning to convene the staff with the official stamp should be forwarded.
And meanwhile, the government has directed attention in allocating a separate location in Paliaguda area for the vegetable farmers to engage in their respective trading activities. The attention was directed after considering the challenges and difficulties faced by the farmers since the closure of the Colombo mining market. The attention was directed in this regard during a meeting held at the Temple Trees with the presence of Head of Presidential Task Force for Economic Revival and Poverty Eradication Basil Rajapaksha. A land plot in Paliaguda belonging to State Engineering Corporation said to be allocated for this purpose. The head of the Presidential Task Force, Rajapaksha, instructed the authorities to resume the trading activities of the mining market will adhere to the health and protective guidelines. The mining market was closed again yesterday after reporting infected patients amid the prevailing COVID situation in the country. Accordingly, around 150 to 200 vegetable lorries which arrive at the market on daily basis were directed to another economic centre for trading purposes. The government expects to expand a fair rate for the farmers of their agri products and supply food essentials for consumers without a shortage. The trading activities in the market expected to resume after conducting PCR tests and ensuring health protectiveness in the market.
The program to distribute 5,000 rupee worth allowance for low-income earning families in Western Province and 10,000 rupee worth essential commodities package for the families undergoing quarantine process has been carried out successfully. The 5,000 rupee allowance was distributed for income-deprived families who have been directed to quarantine process in Maligavatta, Kettarama and Maligavatta East areas. A program to distribute 5,000 rupee allowance for income-deprived families who have been directed to quarantine process in Kaduvela Divisional Secretariat Division was initiated under several stages today. Accordingly, 280 families in Rajamalvatta, Batramulla, Gramaniladari Division received the allowance today. Funds worth 170 million rupees to provide 5,000 rupee allowance for more than 25,000 income-deprived families in Pannala Divisional Secretariat Division in Kurunagala have been received by the relevant district secretariat. Colombo District Secretariat has indicated that the families undergoing quarantine process in Colombo District have increased up to 9,163. Meanwhile, a program to distribute essential food package worth 10,000 rupees has been initiated in Gaur District for 1,370 families undergoing the quarantine process.
Ministry of Transport has decided to temporarily revise the present bus fares from midnight today. The decision has been reached by considering the challenges faced by the bus owners due to the COVID-19 pandemic situation in the country. Cabinet approval has also been granted to revise the bus fares temporarily. Based on the risk conditions, steps have been taken to revise the bus fares under 3 methodologies. Under risk level 1, buses will be permitted to load passengers in the usual manner while adhering to quarantine health guidelines. However, the passengers can be loaded into luxury and semi-luxury buses in accordance to the available number of seats. Under this methodology, the present bus fares charged from the passengers will not be revised. Under the risk level 2, buses will be permitted to load passengers in accordance to the available number of seats while adhering to quarantine health guidelines. Accordingly, the minimum bus fare has been increased from 12 rupees to 14 rupees, which is a 1.2% increase from the present fare. Under the risk level 3, buses will be permitted to accommodate passengers maintaining a distance of 1 seat between 2 passengers. Accordingly, the minimum bus fare has been increased by 1.5%, while the minimum bus fare for luxury and semi-luxury buses have also been increased by 1.2%. The minimum fare of the super luxury buses have been also increased by 1.1%. And with that, we conclude tonight's news. Do it just tomorrow at the very same time. Stay safe. Good night.
Good night.